The average text takes your eyes off the road for nearly 5 seconds.
Welcome to This Week with Sheriff Dave Phelan, a weekly program on LSN television, also carried by a number of our radio affiliates right here in Lancaster and Fairfield County. Do appreciate you, the viewers and listeners that join us each and every week. And again, I mention this every week. I would be remiss if I didn't thank the folks here at Fairfield Christian Academy, the students, J.T. Burcham and the gang that put this program together absolutely free. And it gives the Sheriff's Office an opportunity to share a lot of things going on throughout Fairfield County within the Sheriff's Office and beyond. This week, we're having with us Cathy Mathias, our nurse in charge of our jail. Big responsibility. Welcome you here, Cathy. Thank you. And kind of on short notice, I just asked her a couple hours ago if she could be on. And certainly she does a terrific job in our jail, and it's a duty like really none other. But before we get into things going on in the jail, Cathy, tell us a little bit about yourself.
Well, I'm the medical supervisor at the jail right now, but I've got experience out at the prison as well before I came to the jail. I also worked for Dr. Michaels and Frazier's here in Lancaster, oral surgery. So I have a little bit of experience in a lot of different areas.
And your husband's a fire chief, right? Mm-hmm. So you got that background, kind of the fire medics and all those kind of things.
Emergency services, yeah.
Okay. So you've got a challenging job in there with that. How many prisoners do you come in contact with within a given week average?
Well, we see people at sick calls, so we have anywhere from 25 to 35 people that we see that we set up to see the doctor.
Okay.
And then personally, up until each Monday when they're seen by the MD, me and another nurse that we have will see several people a day, plus receive medications for the people that are already in there. So, I mean, wouldn't be able to give a statistic or anything, but I mean, you know, we see people as needed.
Okay, and I would think that many of the people coming into the jail have not, they're not in good health coming in, right? Or they're not taking care of themselves, they're on drugs, there's a lot of stuff going on with that part of it.
Yeah, the vast majority of the people that we see are, I'd say about 75% of them are either alcohol or drug-related people. So therefore you have withdrawal symptoms that you have to address with each of those individuals depending on the severity of the withdrawal.
And I would think that probably many times they haven't had medical attention for a while.
No. That's why we have to cover it at the jail. That's why there's usually issues with them. Right off the bat, because they haven't. A lot of people that do drugs or consume over amount is what I think of alcohol. They're obsessive with it.
Right.
Their main focus is taking the drugs or taking the alcohol. They don't concern themselves with their own health up until the point where they don't have any more of the drugs or any more of the alcohol, and then is when they start having problems. Because whatever they're taking those drugs or alcohol for has numbed them up to that point to where they don't even notice that maybe they have dental issues, health issues. And so then all of a sudden when they're sober, then all these things start coming up that they need to address for themselves, and they realize they've got quite a few problems.
Is there any... And I think a lot of our viewers and listeners would be interested in this, because you are in with the prisoners. You are dealing with prisoners. Some of these prisoners have serious offenses. You know, they're violent offenders, robbers, burglars, you name it. Do you ever get concerned for your safety when you're dealing with these people?
No, I never have.
Okay.
Basically because I always have a deputy with me,
Okay.
and that deputy is to control the inmate. The majority of the time, the inmates are handcuffed when I see them.
Okay.
And if I need the cuff release to get vital signs or anything like that, the deputy controls that. But basically, the inmates in the jail, if they're seeing the medical department, it's because they've requested to.
Right.
So they're coming to me for help. So they're not going to do anything offensive toward me when I'm trying to offer them assistance.
Yeah, so most of them they're glad to see you.
Right.
Along with the doctor, right?
They want to be there. They want us to take care of them.
And how do you handle like special need prisoners? Maybe someone that would be in a wheelchair, maybe someone that would actually be beyond what we could do for them. How are those situations? Maybe they have something more serious going on, maybe a bad heart, maybe something where they need a specialist.
Well, we arrange for them to see cardiologists if they need to. If we accommodate wheelchair-bound people, we have cells to put them in. If they bring their own wheelchair or we need a wheelchair, we can get one. We take care of people with canes, walkers, oxygen needs. I mean, we try to handle everything we can. If it's to a point where we can't, then we have to let the judge know that we cannot accommodate that person at the jail.
What would be one of the more common things you would see a prisoner for? Is there anything that kind of is like typically I hear in the doctor's office, everybody has the flu. You know, we've heard that there. So do you see some of those same dynamics? And then the second part of the question, you know, these people are in close quarters. It would seem to me that would become even problematic in and of itself, because if they had the flu or something, they'd be passing it on from prisoner to prisoner.
Right. That's exactly what happens. And we also have people that come in, and like you said, they're around a big population of people. Say a female would come in and she finds herself in a dorm with 50 to 60 other people. She's never been in jail before. She finds herself surrounded by people that she's probably never met in her life. Mm-hmm. Okay, that's going to cause an anxiety. I call it jailhouse anxiety.
Okay.
Okay, and they don't understand it, but that's normal. I mean, you or I would be nervous around 60 other people that we don't know, especially if we found out we had to spend the night with them.
Right.
And that's what happens. And so we try, as these issues come up, we try to address them with the people to try to make sure everybody understands their feelings are normal and that they will pass and that they have rights and they can request medical help if they need it, and that the deputies are always there in case there's anything they feel like they need. There are monitors in the dorm that the deputies can push a button on an intercom system, and that goes right into the deputy so they can address anything that's requested of any inmate.
And they get prescription meds, they get all
Yes.
these kind of things.
Yes.
So let's say someone's being treated for some kind of a problem, whatever it may be, and they're going to be discharged. What happens after they're discharged as far as the medications and as far as their future care? And I know that's not our responsibility, but how do we kind of address that?
Well, if they've been prescribed medication or they've brought medication to the jail with them, we always send it with them.
Okay.
Now, sometimes they leave it behind and don't want it,
Okay.
but most of the time they're offered that medication so they can complete their treatment at
Okay.
home.
Okay.
And the instructions are on the medication so they can take care of themselves.
So it's very similar to any of us going to a doctor. Well, I guess the one thought I had, or the one question I might have, Cathy, is what really makes this unique and different from like private practice, or if you were working like in a doctor's office or something like that, as opposed to working in the jail? Are there some things that are very unique or different as far as working in a jail, working with those kind of needs and things, as opposed to maybe someone that was in private practice? I know that's a tough question.
Well, from the nurse's point of view or from the inmate's point of view?
Well, from the nurse's point of view, from your point of view.
Okay, I don't get to choose who I see.
Okay.
In private practice, they do.
That's interesting.
These
Sure.
people, these people need us, and we're there because they need us.
Right.
And so, and we're available for them for that very reason, because they don't get to choose either. You know,
Right.
there's one medical department, and so, you know, if they don't like me or they don't like the doctor,
It's not like they go to another
they
doctor.
They
Right.
can't go and get someone else. They have to be taken care of by the staff that we have.
That's very interesting. You know, you wouldn't
Yeah.
think about that. Yeah,
Right.
Neither one of you have a choice. You have each other there. And that's how it is.
Except for I want to be there because that's the job I chose.
Right.
And so, you know, and a lot of them don't realize that we accepted the responsibility by taking the job to do it.
Right.
And so, and it's because we want to take care of people that were there. It's not because we're forced to do it.
Right. Right.
So, I mean, there is a difference in private practice. The nurses, if they do not want to see someone, they can actually refuse to not see that person, and I do not do that to anyone because if there's a medical issue, I feel like it needs to be addressed one way or another, either by me or by the physician. If the person doesn't want to speak to me about it, in other words, it might be a privacy issue, then I will make sure they see the physician, and that's how that works for prisoners.
Cathy, we're almost out of time. We'd like to have you back next week.
Okay.
And we're going to talk about a situation where it was a life-threatening situation that you were in yourself, and a health issue, and just kind of how that kind of changed your viewpoint a little bit in some
Right.
ways. I think anytime we would be close to death or something like that, I've never had that happen, but I understand. And before airtime, we were talking a little bit about that. And if you don't mind, next week we'll talk about that.
Okay.
Do appreciate Cathy Mathias, our jail administrator, our jail nurse. Does a great job. Been with the sheriff's office about 5 years and has done a terrific job. Do appreciate you, the viewers and listeners that join us each and every week. And again, before we go off the air, reminding everyone that Saturday, February 23rd, at Fairfield Christian Church between 6 and 8 p.m., Grace Haven Ministries, the person that kind of runs that, along with a host of volunteers, is my wife, Loretta Phelan, and it's a great program. It ministers. It has a lot of things that are really wonderful, and the big part of it, there's a lot of girls that get out of jail that have nowhere to go. It is a home. It's a Christian home based on Christian principles, that they do have a place to go. And if you would want to come out and support that, I know Loretta, and we'd be very appreciative of that. That's 6 to 8, February 23rd, coming up on Saturday evening. Well, the clock on the wall says I've got to go. Do again appreciate the folks here at Fairfield Christian Academy that put this program together. And if you're out there driving, buckle up. We'll see you next week. God bless.
We gotta be smarter about what we bite on, okay? I want everyone to go outside. We're gonna run Red Rover on 3.
What about you, Tony?
I'm gonna run around in circles, flap my arms, and make engine noises like this.
When it comes to playing, we kids are the pros.
We're eating right, too.
We fuel up.
To play 60!
Your school doesn't have a program? Be a leader. Start one.
Click today and join the movement.